Well, one of the things that and Ash, you jump in here on this,
Sure.
things I've seen, and then I'm going to be quiet and let you go. For me, fingernails.
Oh, yes.
When I'm on it, my fingernails grow so fast, I got to trim them all the time.
Yeah, I go to examine a patient and go, hey, excuse me, I'll be right back.
My fingernails, toenails, and hair grow like crazy.
So that was, say it one more time?
My fingernails, my toenails, and my hair grow like crazy.
And for some of us, we should have started the hair thing a little earlier. What
are you talking about?
Yeah.
You need to have to have more haircuts than you used to have.
And again, why does that matter? Because when we see a nutritional supplement that's meeting our basic needs, now it allows the things that normally are behind. Fingernail growth, hair growth, those are things, that's not critical. Our body is going to shunt our nutrients to making sure that our heart, our lungs, and all of that are taken care of. The last thing it's going to worry about is things like fingernail growth. But when we're hitting the target of what our body needs throughout the body, heart, lungs, kidneys, everything, we have extra
Cellular metabolism. I mean, again, vital nutrients are nutrients that we use over and over and that we can't maintain even the most basic cellular processes without them. That's why you notice an increase in energy, increase in growth, regenerative properties better. I mean, when I literally, if I'm a coffee fiend, I drink too much coffee, and I can take Rapid Recovery every morning, and I'll not get my coffee and not notice. But if I don't have either one,
right.
Now they're giving me an energy boost for different reasons. Preferably, you'd like to have an energy boost because you're giving your body the nutrients that it needs, not because you're short-circuiting the ATP production, which is what caffeine does. So that's just a point I wanted to make, that it really is just a matter of giving your body what it was designed to, have.
And that's what's so neat, is because we started out a process just to help diabetics. But when we started that, we've learned that, hey, how many of us are deficient. There was actually a study done in the late 1996, the end of that year, where they actually showed that 46% of the most healthy people in the country, these were people that were non-alcoholics, non-smokers, non-diabetics, that 46% of that population was deficient in some critical vitamin, either vitamin D, vitamin C. There was some level that they were low, and we were malnourished. We're an obese society that's malnourished, and I'm guilty of it. I eat out all the time.
Which brings up a great point. That's why this, good nutrition is actually an appetite suppressant. You crave certain nutrients, and that gets translated into just being hungry. That's why you can eat a big meal, and if you don't give your body what it needs, not too much later, a few hours later, or even sooner, you're going to be hungry again. A lot of folks that I've found, a lot of patients that use Rapid Recovery, they'll say, yeah, and I don't find them as hungry, and I eat less. And I know certainly myself that's the case.
And the side effect of being healthy is you feel better energy, and the side effect of being healthy is you lose weight. If you set out to short circuit the system to get something to make false energy or false diet, then you're damaging yourself, and it'll never work. But when you do it in a healthy way, the side effects. One of the things I loved about a few years ago is we started it to help with surgery.
Right.
But afterwards, you kept bringing us these lab values, and it kept getting better and better. Tell us a little bit about that.
And I'm also a diabetic.
Yeah.
And
now, were you diabetic when we first met,
yes.
or did you? Okay.
That's when you started me on it. You gave me some samples and wanted me to try it.
I can't remember everything 4 years ago.
I can hardly remember that long, but I tried it, and as you were saying, my vitals started coming down and getting more regular. And so I have, if I go without it for a week, I mean, I'm just aching all over, and everything seems to have gone haywire. So I definitely make sure I stay on it. And but being a diabetic, and when you did the surgery, it healed up so much faster.
Yeah, I was impressed.
And I've gotten a couple of other people on it that I know are diabetics, and theirs have been healed. They've had a wound that's been healing, and so it's really does good. And I got off of some of the vitamins that I was on too.
Just to be able to narrow it down.
Right, because my B12 started getting, my vitamin B was getting too high. So I got off of all my vitamin supplements that I was on, and now I'm just on Rapid Recovery. So I take no vitamin supplements now.
Oh, those are great. When, oh, go ahead.
After it got rid of the migraines, for me, Dr. Woodall wanted to know what was the in it that did it. I said, I don't know. So I carried in one of the boxes and one of the brochures and a little packet of stuff, and I wrote on there where it could be found at and about the price of it in case he recommended anybody else. And I said, I'm going to let you read the ingredients and read what it is about, and you probably could tell more than I could, you know, what it is. He said, well, whatever it is, said, I'm glad you found it.
And you went off of your migraine medicine.
Oh, yeah, I ain't taken
After
my
being on-
migraine medicine, and how long have I been on it, Carol? You were the one that got me on it.
I don't
It was
remember.
before I had the stroke, and that's been about 2.5 years now, and then I had the heart attack last October, and I was on it. Then and Carol declares that's what helped me get over the stroke as well as I did.
It did.
The heart of how our body is going to utilize different things, and you said that, in case you all couldn't hear that out there, you suffered from migraines for a long time, and a lot of our patients and even just people we know, we started taking rapid recovery because we were getting ready for a surgery or some wound or something, and then the side effects that we found are patients with psoriasis. You know, I had a patient, well, we ended up with 7 in a row very quickly of patients that were getting ready for surgery, and they asked us afterwards, you know, does this thing help with psoriasis? And I'm like, well, you know, it does help with tissue repair and skin, so it would stand to reason, possibly. So we started looking more into that, and lo and behold, a lot of skin disorders were improving. Now, we started with a goal, and we found out it helped with skin. I was one too that I got about a migraine, and if you don't have migraines, when people say migraines, it's not a bad headache. A migraine is a life-altering headache. It is where you can't see,
It's just
you
a
feel sick.
debilitating one.
Yeah, it's exactly what you said. It's debilitating. It puts you down and you can't function. I got one about once every month. I started taking rapid recovery, and I didn't really notice. I was taking it for other reasons. I was trying to exercise and everything. But my headaches really started to spread out to 3 months, 5 months, and then I really wasn't having them. Well, my wife noted that we went on a trip, and I ended up getting a migraine that week, and then when we came back, I got another migraine and another one. And I just wrote it off as a doctor to travel and flights and all that. Well, she was the one that pointed out to me that I had quit taking rapid recovery, and I had quit working out at that time. And she said, do you think that has anything to do with your headache?
Miracle.
Yeah. And I'm a doctor, so I'm thinking, I'm critical of it. Well, I went back on it, and my migraines went away. And then somebody in my church did the same thing. They came over and they said, does this help with migraines? Now, by no means are we saying that it's going to cure migraines. And we're not telling everybody out there it's going to take away chronic fatigue syndrome. Or we have a lot of patients it's helped with fibromyalgia. And we've seen their pain go down and they sleep better. But there's some it doesn't. So there are problems we have that are non-nutritionally related.
But many of them are.
But many of them are, and what Ash and I in our practice have seen for years, and every doctor who cares will take the time to tell you, any surgery, any treatment in a patient that has better nutrition is going to do better than someone with poor nutrition.